session, and it'll be housed on our site, on the PHCRI website, and on the BC Support Unit website. And Emily's email is on here, so if you have questions after the presentation, feel free to contact her. So welcome everybody who's here virtually and those of you in person, and thanks for signing in. I've put a copy of today's invitation, which also gives you a website where you can find past presentations and future invitations. So we won't have another one of these until September 12th, when Alina McKay, who's a PhD student at UBC School of Population Public Health, is going to speak about plain language summaries, turning your research findings into plain language summaries. So for today, though, we're delighted to have Dr. Emily Jenkins, who is an assistant professor at the UBC School of Nursing, who's going to talk to us about a community-based KT project that she led and is still involved in. So welcome, Emily.
Thank you. Hi, everybody. Nice to have people in the room. I was worried for a moment when I arrived that maybe I would just be talking to a computer, but it's nice to have everybody here and anybody joining virtually. This is my first time doing a webinar like this too, so a little strange to be sitting here and bound to my seat, but I'll do my best. So my talk today is entitled Using KT to Enhance Population Health Outcomes. The making of the CollaboraKTion Framework for Community-Based Knowledge Translation. I'm going to start off with a bit of a background to help set the stage for why my interest in this area came to be, and a bit about, well, I'm going to spend most of the time during my talk speaking about the Social Networking App for Resilience study, or SONAR study, that informs the development of the CollaboraKTion Framework. So I'm going to start by going way back in time to when I started my professional career as a nurse working in acute psychiatry. In this setting, I was really loved working with the patient population, but I was coming up against challenges with policies, programs, and system-level challenges that were impacting my ability to provide what I thought was appropriate, competent, and ethical care in this setting. And so I came to believe that we could do better and that we need to do better, and decided to return to school and pursue graduate training in order to become involved in creating systems-level change within our mental health care system. Early on in this training, I was introduced to the concept of knowledge translation, and this idea of using knowledge or evidence to inform action really resonated with me. The Canadian Institutes of Health Research, our Canadian federal health funding body, has been a real leader in the world of KT and has proposed this widely utilized definition in which KT is seen as a dynamic and iterative process that includes synthesis, dissemination, exchange, and ethically sound application of knowledge to improve health, provide more effective health services and products, and strengthen the healthcare system. CHR also distinguishes between two forms of KT: end of grant KT, in which is more of the traditional approach that people are used to, in which researchers make efforts following the conclusion of a study to make sure that their findings are taken up by knowledge users and used to inform practice and improve health outcomes. And integrated KT, which is a newer form of KT, but which has gained a lot of recognition. It focuses on engaging and partnering with knowledge users throughout the course of a study to develop knowledge that really resonates with the knowledge users that it's targeting to improve outcomes for. So I was really fascinated by the ideas that I was coming across in terms of knowledge translation and what might be possible through this lens. But as I started to explore the area further, I was feeling more and more isolated. A lot of the research that I was coming up, that was coming up in my exploration was focused on disseminating a particular type of knowledge, and that was a knowledge that was largely stripped of context. Context is what I'm really interested in. I think that the knowledge that we're producing and that we're wanting to utilize needs to be responsive within the realities of everyday life. In my work in acute psychiatry with adults, I had witnessed the limitations of our treatment approaches the challenges within our healthcare system. And so I'd really developed an interest in looking at how we could use population health perspectives and approaches such as health promotion and prevention efforts in order to improve the mental health outcomes of our population. In addition, I decided that I could probably have the greatest impact in my work by focusing more upstream, working with young people in their communities in order to create healthier environments in which fewer people would end up needing acute psychiatric services as adults. Through this KT journey that I was on, I ended up coming across this concept, which was really quite emergent at the time, of community-based knowledge translation, which I define as a process for engaging communities in the collaborative development, implementation, and evaluation of evidence-informed, contextually responsive initiatives that draw on a public health perspective. So as an integrated KT approach, community-based knowledge translation is informed by tenets of participatory inquiry and of KT science. And you'll hear some of those strands coming through as I describe the work that I ended up doing to inform this area of study more. So having provided a bit of a background about how I came to this place, I'm now going to switch gears a bit and talk about the social networking app for resilience study that informed the CollaboraKTion Framework. So this research took place in north central BC in a small rural community that I refer to by the pseudonym of Lakeview. Lakeview is home to approximately 4,500 residents if you include the town population as well as the surrounding First Nations communities. If you ask local residents what's great about living in Lakeview, what do you like about it, they'll probably tell you that it's very picturesque, as you can see. There's a number of outdoor activities that one can participate in year-round, but it's also home to a number of really challenging circumstances. It lies along a stretch of highway that's come to be known as the Highway of Tears, along which 18 women have gone missing or been found murdered over the last 44 years. Lakeview itself is home to a number of violent acts that have taken place and really shaken the community over recent years. And it has a large population of residential school survivors in the community. So this is some of that context that my study took place in and why I think that responding to and being responsive to context is so important. I had been involved in a study in this community just prior to engaging in the SONAR initiative. And this was a qualitative study in 3 communities, including Lakeview, that was exploring young people's experiences of emotional distress and resilience with the intention of bringing youth voice to that literature. We had developed or created a community report that highlighted key findings of this qualitative study, and we used this community report as a way to re-engage the community to illustrate some of the needs as voiced by our youth participants in the community. And the Lakeview residents were really quite interested in trying to work with us to develop action towards improving mental health for young people in this town. At that point in time, I traveled back up to Lakeview and hired 10 youth as youth co-researchers on the project. These youth were hired in an effort to ensure diversity in gender, in age, and in social location in an effort to enhance the reach of the initiative. Over the course of a year, we engaged regularly, having weekly video conferencing meetings, given the rural nature of the community, as well as a number of in-person visits, which ranged from about 3 days to a week at a time that I made to the community. And through this process, we engaged with a broad source of different forms of knowledge, including local, scientific, and experiential knowledge. In terms of local, we looked at statistics that were available from the local government or municipality. We looked at information on available resources. In terms of scientific evidence, we drew on relevant mental health literature or mental health promotion literature and explored the types of initiatives or interventions that tend to be effective or to show some kind of effect in a population setting. And then, of course, we drew on experiential knowledge of the young people themselves They conducted an asset mapping exercise where they were looking to identify strengths within the local community for young people, as well as just their lived experience and what they thought would resonate with youth. Through this process, they identified the main issues that they felt were impacting youth mental health in this community. And there were 3 of them. The first was bullying, the second was substance use, and the third was racism. And another issue that continued to come up in our interactions with the community, both the young people themselves and adults in the community, was that there was a lack of opportunities for young people. As one of our youth participants shared, there's nothing for teenagers to do. All there is to do is get drunk, smoke pot, and party. That's all there is. And when you have someone like me who does none of those, I have nothing to do. Similarly, another young person shared, sometimes it's like really boring because there's barely anything to do, because a lot of us get into a lot of trouble, like vandalizing things just for fun, because there's really barely anything to do. And so what I think these words help to demonstrate is that the heart of the mental health issues that the young people were identifying and experiencing was a lack of community connectedness, or a lack of opportunities for young people to feel meaningfully engaged with their community, to have opportunities to form those important relationships with adults and peers in their community. And we know from the literature that this is a key predictor of mental health throughout the life course. So identifying this became kind of this core issue that we sought to address. So at this point, I really wasn't sure how the youth were going to figure out a strategy to address connectedness in the community, but I was set on the idea coming from them. Again, drawing on the literature that exists, we know that some of the shortcomings of current youth mental health programming are believed to result from the fact that young people themselves have not been at the table in terms of forming those programs and making those decisions. And so we started to engage in the brainstorming process and try to come up with a strategy that would work for them. And this took quite a bit of time, probably about 4 to 6 months, during which we were talking about what might be possible and trying to encourage ideas and thinking big. And this became quite challenging at times for the youth, who would kind of hesitantly put forward an idea, and then somebody would quite quickly shoot it down and say, well, how would that be possible? Like, how would we do that? We don't have anybody in this community that can do that. And so we were challenged to try and look beyond the barriers that might initially seem to exist and think, if this was a world without those barriers, what might be possible? And ultimately, the youth decided that they wanted to build on youth communication trends and to create a web app that was aimed at enhancing connectedness in this community. It was at this point that the youth identified the name for the study as SONAR, the Social Networking App for Resilience Study, and worked to create related branding. So we had a graphic designer who was located in Vancouver and who worked virtually through video conference to take the youth's ideas and to create this logo and related messaging. The youth engaged in a number of public presentations throughout the project period. A few of those took place at the local city council, and the youth were presenting the work that they were doing, talking a bit about why this was important and what it was that they wanted to do to try to address these issues. And city council was really responsive to these youth and to their ideas and wanted to support them, and actually ended up putting forth the money that was required to build the web app. So that was a really exciting opportunity for the youth. Given that there wasn't that skill locally, we ended up working with a web developer, again virtually. This person was located in Ontario. And the youth really wanted to create something that was simple and easy to navigate. This is a screenshot of the web app that was ultimately created, and I think they achieved that goal. The web app consisted of a number of different areas that youth could access. One was the calendar that would house all opportunities that existed for young people in the community, and so people would send in this information and the youth would actually post it up there. The results of the asset mapping exercise that the youth carried out was also housed on here, and this was meant to be a living living documents where people could continue to add these sources of strength. It was kind of like a Google map, so those kind of, you are here, red flags were located throughout, as well as photography, pictures of the sites that the youth had identified, and little write-ups about why this was a safe place for young people. We also had an area where there were evidence-based resources for youth who felt that they had mental health challenges that required more attention, and an opportunity to try and spark a bit of civic engagement where people could send in ideas for positive change within the community, and that information then relayed to local leadership to inform change. So when I gave the definition of a CBKT, or community-based knowledge translation approach, I mentioned that evaluation was a component of it. So I'm really trying to make it that any CBKT process would have this accompanying assessment. And so now I'm just going to talk a bit about from that process to the outcomes that we saw. We utilized a mixed methods assessment to explore our concepts of interest, which were mental health related. We used quantitative surveys and qualitative interviews. The quantitative surveys were comprised of standardized questionnaires on resilience and on emotional distress, as well as an open-ended question that sought to get at connectedness. And the qualitative interviews were done with key stakeholders with the intention of identifying the community's perspectives of the impact of this project. The quantitative surveys were delivered at the beginning of the initiative and 8 months into the project, and the qualitative interviews were conducted at the 8-month time point. To go back to the quantitative surveys, the detail was that these were given to all youth in the high school setting. So any young person who was attending the high school was invited to complete this survey. So the quantitative data indicated that indeed mental health problems were a significant issue in this community. While we would expect that a population of young people would have a prevalence of around 20% demonstrating a mental health challenge, our data indicated that that was more than 3 times the case in this community, with 61.1% of our participants screening positive for clinically significant mental health problems. So in addition to these clinically significant mental health problems, there would have been additionally youth who had mental health problems that didn't meet that cutoff point, but still probably required intervention and would have indeed benefited from early intervention. So this made this project, which focused on all youth in the population because it was a mental health promotion project, really important and timely. We did a number of statistical analyses which indicated that in the time point measured, distress did not seem to be impacted by this intervention or initiative, but we did see increases in the positive aspects of mental health that we were measuring, resilience and connectedness. This is what we call a sociogram of youth connectedness for this community. It was created using social network analysis methods. And so this was using the connectedness data that I said we collected from youth in the school setting. So each of our youth participants was asked to identify all people in the school setting who they could go to if they needed somebody to talk to or some kind of emotional support. And that they were asked that both at the beginning of the study and at the 8-month time period. And so this is a picture of the network that the youth identified for their community. You'll see at the center of this graph there's a number of individuals who have identified connections. They are connected within the graph. Some of them are more highly connected with others, as you can see by the larger points in this particular diagram. But around the edge you'll see, or the periphery, there's a number of dots that are not connected. And so these are individuals who have not identified a single source of support within that school setting. So I like the use of social network analysis for this community-based type of work and for looking at change over time, because I think it provides a really powerful image to take data back to the community and help them to understand why this is important and to watch how things might change over time. So the neat thing with social network analysis is that if we had multiple time points, that we'd actually see how the graph changed over time. Interestingly, the data that was used to create this image also indicated that at the 8-month time period, those who had the greatest levels of engagement with the initiative, that is, they had actually identified using the app, had identified 2 additional people within their network as compared to earlier on in the study. So it seems that they were starting to become more connected. So in addition to the quantitative data that we collected, we really wanted to understand from the community how they felt that this initiative was impacting youth mental health for them. And we identified a number of key themes that helped us to see what the impact was both on an individual level and at a more community level, which was quite exciting. The key themes were enhanced self-concept, knowledge and empowerment, youth leadership, advocacy and shifting community practices, blurring boundaries, and the importance of youth voice. So I'm going to take a few moments to illustrate a couple of examples which help to see how things were shifting in the community. In terms of youth leadership, advocacy, and shifting community practices, one of our partners said, having more of a youth presence on our local committees, having their input. I mean, we're planning our community center right now, so having youth around the table while we're talking about what to include there, that's huge. And in fact, we deliberately plan our meetings at the high school so youth can attend. This represented a really significant shift in how youth were valued in the community, and how they were now being seen as a resource and included in planning that was going to impact their lives long term. This is particularly exciting to me given the broader health promotion literature and health promotion intervention literature, which indicates that it's these shifting norms at a community level that are really responsible for impacting health outcomes longer term. So I was excited to see this as one of the examples. We also saw blurring boundaries, which was really also an exciting shift to see in the context of the youth identifying racism and bullying as particularly problematic in this community. One of the teachers that we spoke to said, bringing together groups of people that seem dissimilar at first, that conversation is the most important element of this project. Different kids talking to different kids about the same thing. All different grade levels, different genders, different socioeconomic groups, different cultural groups, different academic levels, that conversation. I see all these youth collaborators talking to each other and other kids notice. And so this was helping us to understand how this project benefits not only the youth collaborators themselves who were highly engaged in the project, but how that was trickling out to other members of the community, both young people and adults. So the benefits for us of using a mixed methods approach was that it really helped, the qualitative data really helped to provide more of a nuance to the quantitative data, while the quantitative data helped us to get an understanding or paint a picture of what the impacts were at a really broad community level, drawing on data from a number of high school participants. So sustainability was something that I was really interested in throughout the process of this study. As somebody who is engaging in community-based work, it's really important to me that we start to try and plan on how this work is going to continue once funding runs up, once I step back from my active involvement with the community. And so we've worked quite hard to try and identify, for example, another adult in the community who would help to continue to engage youth and to create a space for them to come together regularly for their youth meetings. And while I haven't continued to collect data to look at long-term sustainability, because of the relationships that I've created, I've been able to go back and to find out what's continued to happen since the study itself ended. And there's some really great things. The community has put in 3 successful grant applications that have continued to kind of fuel the work that they're doing, the largest of which was a $50,000 grant to support the development of a youth theater program in the community. And this was really exciting because that type of programming is one of the things that will provide those opportunities for youth to develop those meaningful and healthy relationships that they were seeking. It's also quite exciting in a community where those arts-based opportunities were non-existent at that point in time, and everything was quite oriented to sport, and quite oriented to sport for those who had the resources to participate in those. The youth have also established a media presence, both locally in local newspapers, that helps to get the word out to the broader community, more likely adults in the community, but important nonetheless. And they also got to participate in a national radio interview with the CBC radio to talk about the work that they've done. So I think that that was a really exciting recognition of the hard work that they've put in. They've had the opportunity to engage broadly with mental health stakeholders in our province, coming down to Vancouver to participate in an annual event that brings together people who are interested in mental health. And that provided them the opportunity to meet other people and also to identify other resources that they were able to take back to their community and utilize. I should mention, in terms of the theater program, they were going to focus their first production on a mental health issue in order to continue to try and break down the stigma that remains an important barrier to mental health intervention, both in their community and more broadly. They continue to develop additional opportunities for young people, and there's clearly a sense of community ownership, empowerment, and capacity, which as a community-based researcher is really exciting to see. So I don't want to give the impression that this project was all smooth sailing. There were a number of challenges throughout, and I'm going to touch on a few of them. One of the greatest challenges was continued youth engagement for a year-long period with weekly meetings. And so youth involvement fluctuated throughout the course of the study. Sometimes we'd have 2 people show up to a weekly meeting, sometimes all 10. And so while really frustrating at times, I returned to some of the earlier data about young people's experiences in this community, which really shed light on the contextual factors that were impacting youth engagement, and the fact that young people had many responsibilities in this community for working full-time to try and support the family income, to taking care of siblings while family members were working in other communities for days at a time, to situations where young people were having to live independently because of circumstances in their home life. And so being able to participate and commit to this regular meeting could be challenging at times. We also saw that the adult engagement wasn't as great as we'd initially anticipated or that had been promised at the outset of the study. And again, reflecting on the contextual factors in this community, I came to believe that the people who had the resources and capacity to engage in this type of work were stretched so thin, working to try and address all the other issues that they were working on within this community. And so while we would go to them and they would state that this is really important work and they were so excited that it was happening, when it came down to actually having people step up, that was a real challenge. And so within all of that, another challenge was that as a researcher, I was continually questioning whether I was doing an okay job at engaging with the community, whether this was meaningful work to them, whether it was resulting in the types of change and important types of action that we wanted to see. And so as somebody that really likes to kind of be able to plan and know what's going to happen, this type of emergent work was made me really uncomfortable at times, and continues to, but I think that the benefits outweigh that. A couple more limitations that I wanted to touch on. Because this was a one-year study, that's a really short period of time within which to do this type of work and to measure outcomes. The claims that I could make from the findings would have been strengthened had I been able to have additional data collection points. The relationships that I would be able to build would have been strengthened by more time within this community, and so those are a couple of the primary limitations of the work and the research outcomes themselves. And so now, having given you a background of the types of processes that we were engaging in throughout the SONAR study, I wanted to now introduce you to the CollaboraKTion Framework for community-based knowledge translation, which was developed through the data from this study, as well as some of the broader population health intervention data. So I really wanted, when I set out to do this work, I really wanted to make a contribution to KT science. I saw this important gap in understanding how we go about doing KT that addresses population-level health outcomes as opposed to this more clinically oriented KT that had existed previous to that. And so at the midpoint of doing my study, Kitson and colleagues out of Australia published their CoKT framework, which is focused on population health KT. So really exciting. They're really well known, do really great work, and so I wanted to contribute still by building upon their work, and so I decided to apply their framework as an analytical strategy to my data. And so this is the CollaboraKTion Framework for Community KT that was produced through that process. It, as you will see, has these 5 phases. These 5 phases draw on the 5 steps that were identified in the CoKT framework, but are slightly different and are orientated to demonstrate that I see this as a very iterative process as opposed to a linear one, as was depicted by the CoKT framework. I think that in community-based work, we're continually negotiating and working with our partners to understand what makes the most sense, what's going to work for them or what's not. And so we have to be flexible in how we go about these different phases of the process. The other main difference that I've identified in this approach is that the study and researcher contexts, which are located in the center of this diagram, I've depicted as overlapping as opposed to a siloed separate context, to indicate that, I really see that when working together in partnership, each context influences and shapes the other through this work. In addition to these 5 phases, I've identified key elements of the process that I think one could expect to encounter as they're doing this type of work, as well as at the bottom of the diagram, this list of anticipated outcomes that one could expect through using a community-based KT approach. And these were established by drawing on the data from this study, as well as a synthesis of the broader population health intervention research, which identifies what can be expected by doing population-based work in terms of change and ultimately health outcomes. So just to briefly walk you through the 5 phases, and you might be able to recognize where these came up in my description of the SONAR study. Hopefully that's the case. The first phase was the contacting and connecting. That's really the process of building those relationships or partnerships with the community that you're working with. For me, that initial step involved taking that community report back to the community and engaging in discussions about youth mental health and what they viewed as the issues and challenges that they wanted to try and address. The second was deepening understanding. So that was working with the community, again, to really flesh out what it was that they saw as important health factors, challenges, issues in their community, and to draw on different forms of knowledge to understand those issues and to develop an initiative or intervention to deal with that. So for us, that meant understanding through local evidence, through scientific knowledge, and through experiential knowledge. Then we went through a stage of adapting and applying the knowledge base. So that meant the brainstorming part, creating a vision, identifying what the formal initiative might be. We moved on to supporting and evaluating continued action. So continuing our partnerships, taking our initiative to the community, taking action in order to facilitate the dissemination or uptake of the initiative that we're trying to get out there. And finally, transitioning and embedding, so efforts to try and make sure that there was some kind of sustainability to this initiative. And so throughout this process, we often return to our connecting and contacting and connecting stage when additional partners were identified and brought on board, and then jumping back to another phase that we might be in at the time. And I just wanted to go back to a point on sustainability that I meant to touch on, and that was that, again, I've been thinking a lot about what sustainability means in the context of these community types of interventions. And so ended up drawing heavily on the organizational change literature and broad systems change literature, in which it's identified that it's not so much the particular intervention itself that we should seek to try and sustain, but rather that we should be working towards trying to create a culture in which people feel that they have the capacity and the resources and have identified an evidence-based focus in order to try and address. So for us, as opposed to trying to sustain the app itself, we instead try to encourage people to continue to work towards this idea of community connectedness. And so that recognizes that over time and in a community-based setting, needs shift, the population might shift, and what works for them or doesn't or resonates with their needs is going to change over time. And so by identifying this core issue that we can work to address, they can continue to make adaptations as things move along in their path and as things may be improved and bring in different ways to try and address this issue on an ongoing basis. So that concludes the formal part of my presentation, and I'm really excited about the CollaboraKTion Framework and the gap that I think it fills in understanding how we might conduct this type of work. The new project that I'm currently going to be focusing on, and then I just achieved funding from CIHR to do, is exploring how we take this work up a level to engage with policy members, policy stakeholders, to ensure that the efforts that we are trying to work at changing, that they're supported by systems level types of action to create that change that we want to see. Thank you. So now, any thoughts, questions, comments?
Yeah, I have a couple of questions.
Yeah.
Very good presentation. I really enjoyed it. Thank you. I was looking at the integrated KT.
Yeah.
So would you say your KT, the one you're currently working on, is the integrated KT?
Yes.
And was developed by you?
Well, it's a form of, sorry. Okay, yes. So I was asked whether the research that I just spoke about, whether that's integrated KT and developed by my team. Yes, it's integrated KT. So I view community-based knowledge translation as a form of integrated knowledge translation, and specifically focused on a community setting and seeking to address population-level health outcomes. So that's what makes it kind of unique. And the community-based knowledge translation concept was definitely in the literature in very early stages. So I've just thought to build upon what was there and try to fill a gap in terms of how it is that we do it, and to contribute a bit around the science of understanding what the process might be and what the related impacts might be. Yeah.
Is this the first or the only project that the integrated KT has used?
No. Integrated KT is used quite widely now by people who really feel that in order to have impact in our work, we need to bring the knowledge user on board much earlier on in the creation process as opposed to the dissemination process.
And my last question, okay, for now, were you restricted by funds?
The question
because you have a 1 year, you had 1 year, you had all this going on, and were you restricted by funds, and would you have done more if you had more funds?
So the question is whether I was restricted by funds and whether I could have done more with more funds. I think the answer is yes and yes, and absolutely more funds I think would always be helpful. I was restricted by funds, but also very fortunate to be supported by some money from the Canadian Institutes of Health Research that my supervisor held at the time, and that had funded that initial qualitative study on emotional distress and resilience. And so because this was such an important issue that was identified in this particular community, we were able to use some of that funding to support my work and action in this community. And if we had had more money, and I think time is really what impacted this project. I think that, you know, time and the presence in the community are really what kind of deepens those relationships and makes them meaningful. And so perhaps it actually wasn't so much the money itself that time. Thanks for your question. Okay.
First question is, you mentioned that you did take this survey in high school, and presumably that you provided also in school. Were there any youth and communities who did not attend school, or were you able to connect with them around the project?
Great question. An important question. Yeah, so that was one of the limitations of this study, is that we were engaging with a population that was in school. So presumably there's a number of people, young people, that we missed and that this initiative would have been particularly relevant for. I guess one of the benefits of using a health promotion approach is that hopefully those young people would still potentially benefit in that there's being change created at a community level that presumably they would still be impacted by. This was carried out in the local high school, and there was also a alternative program that many of the youth attended either completely, like as their full-time school program, or they did some school in the regular program and some in this alternative program. And this alternative program was meant to help young people who were at risk of not being able to complete in a traditional program to be able to do so. That included some young parents, for example, or some young people who were struggling in the more traditional system. So we were able to capture some of those who weren't in the traditional system, but not who weren't attending school, unfortunately.
Question? Were you able to complete partial participation in particular participation in the project before ensuring some level of outcome?
Sorry, it's echoing, so I couldn't fully hear.
Were you able to link your social participation in the participation in the project?
Yes. So, so what we did actually look at, and I have a slide here, is the differences in outcome based on level of interaction or engagement with the project. And so because we had some challenges with our data collection, in the sense that we ultimately came to believe that the baseline data was contaminated, in the sense that we'd already been engaging in that community. We'd done this initial study in the community, we'd built relationships, we talked about doing this further work, we'd been working with the young people themselves for several months. We didn't think that this was a true baseline. And so what we decided to do was to use post-test only data based on level of self-identified engagement to look at those outcomes. And so here you'll see that we divided into 3 levels of engagement. The first being that they never heard of the SONAR project before, the second being that they'd heard of SONAR, and the third being that they'd actually accessed SONAR, being the app itself or some kind of aspect of the initiative. And so you'll see that while the stress itself was not impacted by level of engagement, both resilience and connectedness were. And I spoke earlier about how we saw with the connectedness data that those with the greatest level of engagement actually demonstrated the greatest level of connectedness, and in fact showed 2 additional supports in their network at the post-intervention time point.
great project, I'm sure with other communities involved, whether it's really or other frameworks.
Yeah. So the question is about whether I've thought about transferability of this type of project, and indeed I have. I think that the transferability would come through utilizing the framework, for example, so drawing on the processes that we identified as meaningful to this type of work and applying it in a different context. And I have been doing that in a few of the projects that I've been working on over the past year, one of which has been in our inner city communities, exploring play opportunities for families who experience multiple forms of marginalization, and so looking at how that might play out. And as I mentioned, about to launch a study where we're looking at how we can engage young people in the healthy public policy making process to promote mental health outcomes. And so the intention of that study being to make sure that young people who have traditionally not been at the table have the opportunity to gain the skills that would be necessary to talk policy language, to engage with policymakers, and to have a voice in issues that impact them. So that's the CollaboraKTion Framework has been posed as kind of the key guiding framework for the study, and so I think we'll be able to get some interesting findings from that, and that will take place in 2 communities in British Columbia and 1 in Alberta. So we should have some good data in the next few years about the transferability. Yes.
The recognition that the intervention was both staff and the purpose of community engagement.
So I think that the question is looking at or asking about whether or not I was looking at the impact of the app itself, or whether I was looking at the impact of the app in addition to the other forms of outreach that we were doing. And yes, we weren't necessarily looking at the app itself. We were viewing the SONAR project as consisting of the app, but probably more importantly, to be honest, it was all of the work around talking with the community. The app really served as a mechanism to spark dialogue much more broadly within the community about young people's needs, and it was a way to demonstrate that to the young people that we valued what it was that they wanted to use as their mechanism, while at the same time going beyond that and using it for further engagement. So both the quantitative and qualitative data would have captured a bit of the impact of the entire initiative, and the qualitative data allowed us to understand things like, for example, the youth gave a presentation during a school assembly, and this was a really turned up in our qualitative data as quite a powerful opportunity for the community to come to understand mental health in a different way. And one of the youth collaborators had been very intent on telling her own story. So we had youth collaborators across the spectrum of experience with mental health challenge. So those who had never heard of what a mental illness was, through to those who had experienced acute psychiatric hospitalizations before. And we did this because of the health promotion orientation. So she really wanted to tell her story to her school, and the school counselors were quite apprehensive about that and concerned about whether that would create further risk for her within the school and within the broader community. But she was set on doing that, and it turned out that that was extremely valuable for both youth and adults in the community. One of our participants shared that it was through hearing her story that the conversation within the school started to shift from mental illness being this really frightening set of challenges that people experience and have to deal with, to a more mental health orientation where we recognize that people can have wellness within the context of having a mental health problem. And so that was really exciting, and that was through some of the outreach work that they were doing.
One of the slides, you mentioned 15 31.1% at mental health. And I was wondering, usually when we talk about mental health, some people include those with substances, others don't. In your study, was this population a population of mental health substances, or just mental health?
Yeah. So the question is whether the standardized measure that I used for emotional distress was inclusive of substance use, and it was not. And so that would have been actually a really important measure to have for this community, well, for any community. Yes. But I used the Pediatric Index of Emotional Distress. It's a standardized questionnaire that has been validated for young populations between the ages of 8 and 18 years of age. And so because it could be used with such young people, we thought that it was a really good tool to use with a population where there was mixed levels of literacy, in which people struggled with being able to read and comprehend. People also had support to fill out the questionnaire if reading or comprehension was an issue. Yeah, including a substance use measure would have been great. The PIED focuses specifically kind of on the concepts of what we would call anxiety or a depression type of issue. So 61.1% is the population that would fall into a concern about a depression or anxiety type of symptom.
And in your experience of throughout your period there, did you find any issues with substance use?
Sorry, the question is whether I found issues with substance use. Yeah. Substance use is huge in this community, and in fact, many of the youth described using it just to deal with boredom and lack of opportunity. So, and then there was, there's a context in which there were people in this community who were dealing with really complex mental health challenges as the adults in the community, many of whom had substance use disorders probably, and who, that was kind of the environment within which young people were growing up. So it was one of those three issues that they identified as important for mental health in their community.
Well, first I wanted to say thanks for sharing your research. I'm working with First Nations Health, and we're always happy to see community-based approaches in rural BC. So very glad to hear your story. My question is about one of the last things you mentioned in your presentation, about fostering a culture that sort of emphasizes the idea of change in space. First, I'm wondering if you had that in your mind at the outset when you first approached the project, or was it something you more emphasized when you were thinking about the sustainability of your intervention? And secondly, did you see any sort of correlation between how much that sort of culture was adopted and the sort of individuals in the community? As you said, some had very fluctuating participation and commitment to the project. Others were, I guess, more sort of involved, perhaps. Did you see sort of relation between how well that culture was supported by particular?
That's a great question. So the question is about whether or not I had this orientation of supporting a culture of continued improvement or action at the beginning of the study. That's the first question, so I'll start with that one. And the answer is no, I did not. I was just more thinking about how do we make sure that some kind of action continues after I step away from the project, and what can I do to make sure that the young people themselves feel supported to be able to continue this work after I'm done. But as we started to move through the process, and it was more at the analytical stage where I was looking at what was going on, how we started to identify that beyond these three mental health kinds of challenges that the youth were identifying, that there was this more core issue that needed to be addressed, and that we believe that would ultimately help those other issues that were identified, that we started to think about and draw on that other organizational change literature that I found really useful in trying to think about sustainability in the context of a community setting and what we might want to see. And then in terms of your second question, can you just one more quick time?
Yeah. Were there individuals in the community who helped to foster that culture, and how does that relate to how often or frequently participate in the
So the question is around whether there were certain people in the community who kind of adopted that orientation, and whether that influenced their engagement in the study. Again, because of the point in time within which that idea of a culture of continuous improvement came to play, there wasn't a formal effort to try and kind of measure or make sure that we were having that orientation. What I would say is that we had people who kind of really became empowered by the process of talking about these issues and seeing that they actually had the resources in terms of their ideas, in terms of being able to kind of bring their minds together to create action that resulted in meaningful change. And so I think that in itself kind of helped to create that culture. One other thing I just wanted to note in terms of sustainability, and it's a super concrete thing, but they used, when they were developing the web app, they received training in managing the app itself. And so the intention of that was to support sustainability so that they would be able to continue to make changes once the research was done, but also to add another skill set to their tool so that they go away with a skill that could be transferable to other situations and circumstances. And in the setting where there wasn't anybody who was able to do web development type stuff, we thought that was a really neat skill to be able to try and build by them. Thanks for the question.
They want to know how you as researchers got first engaged.
So I'm not sure that I have a really solid answer for that. We work in really interdisciplinary and collaborative research teams, and I think nursing does a really fantastic job of that, of working across disciplines and engaging the partners that they need to engage in order to solve a problem. We're really practical that way, and so I love that we do that really well. And so the research teams that I was working with at the time, we had people from population and public health, from gender studies, people with skills or expertise in relationships with Indigenous health and related communities, First Nations communities, people from the social sciences, a huge range of research stakeholders. And so I believe this community was one that that team had been involved in doing some work, actually, I think in sexual health at some point in the past, and found it a really a good community to work with, and one that really wanted to try and continue to engage with research, to try and appreciated the role that research could play in informing change. So that's how it came to me.
Exhausted all the factors?
Well, thank you for engaging with me and all the great questions, because they're really pertinent, and make me think about things that I might consider for this next iteration moving forward. So it's really helpful.
I